Hello and good morning, dear viewers. You're most welcome to the DAKTARI program, a health episode which airs here on West Nile TV every Thursday from the hour of 11 a.m. to noon. And also we welcome you back from your festival holidays, the Christmas periods, and also the New Year's Eves, and hope the New Year is taking you well. Today we have another package for you in regards to your health, and we are delighted to be again joined by a professional from IMC CK Rua branch who will introduce himself. Then we introduce our topic of discussion today. Thank you. You're most welcome to the DAKTARI program, sir. You can introduce yourself.
I'm so happy to be here again on the DAKTARI show. My name is Dr. Rangatoni, and I work with CK IMC Rua branch, and I'm happy to be here. And Happy New Year 2025.
Our topic of discussion today is going to rotate, be mainly about your bone system, especially to the young ones and also the adults, and that will be in regards to rickets and also osteoporosis. They are a bit, maybe we could have heard of rickets, not osteoporosis. We have Dr. Tony who will discuss for us what it is and how you could be predisposed to such a medical condition or maybe life-threatening condition. However, in this first segment, we are going to first look into rickets. We would love to know from you, Dr. Tony, what's rickets for the viewers?
Rickets, it's a disease of the bones that comes in as a result of deficiency in the levels of vitamin D. As simple as that. It's a deficiency disease for the bones as a result of decrease or deficiency of vitamin D.
Thank you very much. However, we would love to know from you. We have had often cases of rickets in the community.
Yes.
And what we have seen, these children who have rickets, they have these scuffed legs. Does rickets only affect the legs, or you could take her through the other bone system which is affected by rickets?
All the bones, be it the head, be it the ones of the chest, be it the ones of the arms, be it the ones of the legs, all of them are affected in rickets. And first of all, to separate the two things, we have what we call rickets in children, but you as an adult, you can also get what would have been rickets in adults, but it's not called rickets, it's what we call osteomalacia. Both the adults and the children, both of us can lack vitamin D. But once a person develops decrease or deficiency of vitamin D in the young, we call them the young simply because their bones have not yet fully grown to a point that they cannot elongate or become longer any further. That's when rickets qualifies. But if your bones cannot elongate further, that means your growth plates have become ossified, or how can I simplify that? Like, it cannot elongate further. We term you to be having osteomalacia. So you will find rickets only in children, and in adults who are having the same presentation, the same cause, vitamin D deficiency, now we call it osteomalacia. But the point that the system that is affected is the skeleton, and that will disturb the bones of the skull. As we shall find in the signs and symptoms, you find different presentations. Come to the chest, to the ribs, comes to the arms, to the legs, so the whole system of the bones is all affected.
Actually, for us, I believe also the viewers could have thought rickets is only for the children. However, he has made it clear even adults could get it, which is called osteomalacia. However, we would love to know from you. You said it's a deficiency of vitamin D. This disease results from that deficiency, or the body lacking vitamin D. Which things could the viewers be doing in the community which could predispose these kids to lack vitamin D?
Okay. In the past, you used to find your household is here, It is open, it's not fenced, and you're having maybe like a grass-thatched house. To go to the washrooms, you have to move outside and you go to the washrooms. It's not inside the house. But in this modern day era, you find people are living in apartments and they don't want to come even next to the door of the neighbor. Those are some of the things that are actually presenting us to such diseases. God created us whereby we should be in open, where we can get free sunlight, because it's one of the major things in how we get vitamin D. But now our keeping indoors most of the time puts us at a risk. So you find someone gives birth to a baby. First week, they're inside the house. Second week, they're inside the house. All they do is just breastfeeding. But the baby needs this sunlight. So as time goes on, if they are not getting exposed to the sunlight, they will definitely get this vitamin D deficiency. Then our location, but now this applies to those who are living outside Africa, because in Africa most of the time we have the sun available, but we have those countries whereby they are mostly under the shade of the clouds. They are not able to get that sunlight, the UV light. Those are usually the ones in the upper hemisphere and those in the lower of the earth. So for them, that puts them at a risk of getting the vitamin D deficiency. Then we have something that can actually perturb your mind. The babies. Having a baby whereby the only thing the baby feeds on is breast milk, that puts the baby at a risk. Now, I'm not saying that you should stop breastfeeding your baby. We have to breastfeed the baby 6 months, exclusive breastfeeding for 6 months. But we have come to find out that the amount of vitamin D in the breast milk is little. You get it? So we have to find alternative routes of supplementing the vitamin D, that small amount they get from the breast milk, to ensure that they can top up and they don't get into this criteria of being deficient in vitamin D. Then we have some of the medications. You'll find that some of the children, they could be on medications for things like epilepsy. We have found out that those such drugs, we call them inducers in medicine, they start up some of the enzymes that come and degrade this vitamin D before it works. So you find that the patient or the baby will be predisposed. Majorly, yeah, I think that can put you at a risk. But the major thing, being indoors most of the time, please, let's move out. Let's associate, let's get exposed to the sun. It's of our good health.
I hope the viewers have gotten to know those who some live in self-contained rooms. Please move out. Is telling us lack of exposure to sunlight could put you at risk of getting maybe your kids to get these rickets. However, also would love to know from you, how can someone get to know that maybe the flags, green flags, that his or her child has rickets? Yeah.
We have vitamin D deficiency in children and vitamin D deficiency in adults. I'll focus more on the young ones today. For the babies, you will find out that actually they will take long to develop their teeth. Someone has made 13 months, but the teeth have not yet grown. That's a warning sign. Okay? We have this small thing here in children that usually beats, or we call it pulsating. It's called the anterior fontanelle. Now, in children who are having rickets, you'll find that it will delay to close up, simply because the bones are not growing as they should be growing. Okay? So you find it will be delayed. And you will also find that their bones are soft. Just to take you back a little, because this is almost taking me to the signs and symptoms of how the patient presents. We need this vitamin D for a reason. Once you get exposed to the sunlight, God created you in such a way that you have what we call cholesterol under the skin. When that UV light strikes your skin, your body will make vitamin D from the cholesterol that is under your skin. Now, vitamin D has a function it does in the body to ensure that our bones grow and they become hard. Okay, so you get the sunlight, it converts the cholesterol to the vitamin D, it will go to the liver, it will go to the kidney until it's in the active form. Now, it's the function of that vitamin D to push calcium from the blood into the bones so that our bones become strong. It's just like you building a house and you're putting cement, but within that cement there are also holes. It will not be so hard. But when you remove all those holes, all the air, I usually see the builders when they're building, they put cement, then they ensure they shake that concrete so that it settles completely and there is no air bubbles in there. The same thing applies to our bones. We need the calcium to push into the bones so that they become compact and strong enough. So you will find that someone who is lacking vitamin D, the whole process we have talked about is going to be disorganized. So there will not be a flow of calcium from the blood into the bones. So our bones are going to be weak. So some of the symptoms we are going to see are as a result of the bones being weak. So it will disturb all the bones from head to toe. Like we have said, the anterior fontanelle delays to close simply because the bones are not growing as they should be. Then, for the bones, still the bones of the skull, they are soft. If you have heard of, there is a small ball that children usually play with. When you press it, it makes a sound. Yeah. So that ball, when you press it, it forms a depression. For the skull, that kind of fracture, we call it a ping pong fracture. So such babies, you find they have what we call craniotabes, and when you press their bones are so soft that it can make a depression. So already that's a warning sign. Okay. When you come to their chest, for the Catholics, they have a rosary, and there is what we call rachitis in children. It's like they have a rosary inside their skin. You find that this chest, where the ribs come, we have a bone here, a short one called the sternum. The ribs come from the behind and they get attached to that sternum. So in rickets, these ends of the ribs, where they are attached to the sternum, there is that swelling of those ends of the ribs. So under the skin, on top of the skin, you will see that, okay, yes, this is the chest of the baby, but you'll be seeing swellings that are going step by step, going down, like a rosary. That's where that synonym of rachitis is coming in. So when you look at their chest, they have those swellings on the chest. Then the other thing, their chest also does not develop normally. When you look at a pigeon or a dove, it has sort of like a protrusion in front. So their chest also, because the bones are not growing normally, there's that curving, or what we call the pigeon chest. And you see it with those babies. Then we come to the arms. These arms here, there is what we call cuffing for the wrists. It's called cuffing simply because the bones, that is the radius and the ulna, they swell. So the child will have a normal anatomy or normal structure of the arm, then it will make a rise on the wrist on both sides. Okay, so that cuffing also is a sign that the bones here are not growing very well. Come to the abdomen, usually they have a pot belly. Now, pot belly is not a sign of money or being well nourished. It's a sign of that we have deficiency. Come to the legs, most of us know of the curved knees or the bowing of the legs, but it's so funny that they can get extremes. They can have the bowing, they can have the knock knees, and they can have also one leg being a knock knee and the other leg being a bow. Okay, so there are very many presentations in terms of the legs. Then the other thing we find out is that there is what we call failure to thrive. By the time you lack vitamin D, most of the time even the other nutrients you are lacking them. So you find out that they don't grow normally.
Hope for the viewers you have gotten to understand a concrete observation in case any of your children has any of those signs and symptoms. It could be an indicator that they are living with, or maybe they have rickets. However, I would love to know from you. We have seen in the community, you brought out the aspect that the bones are weak. So we have seen how people in the community tend to mold these legs. Is it advisable then? Also, you could give him some home remedies, if any, before these parents bring such kids to the hospital.
I'm trying to remove that bowing of the legs to straighten them. Even when they come to the hospital and we find out, yes, it's a result of calcium being low, yes, we shall put them on the treatment, but to help align those bones, simply because they are still growing. But should the bones ossify and they cannot elongate anymore, we cannot help in there. But because they're still in an age where the bones are still flexible enough to get back to the normal, yeah, they usually put some POPs to ensure that the bowing can be recovered. The other sign that I had forgotten, it's to do with muscle weakness. These children are usually weak, simply because they're not getting enough calcium even just to support their muscles in terms of contraction and all that.
Maybe the parent has brought the kids, they identified any of those signs and symptoms. The bones are weak, the children have pot bellies, they have soft bones, the legs are bowed. They have come to you to the hospitals. How do you always confirm that this is rickets?
Those signs and symptoms, some of them are key in making the diagnosis or coming up with the diagnosis of rickets. But we do some lab workup, and in the lab workup we can test for the amount of vitamin D. When we find it is low, then we try to investigate further what could be the reason. Is it just the feeding issue? Is it an issue of being not exposed to sunlight? Are we having the problem with the liver? Because remember, we said some of the things that do activate this vitamin D, when you have formed it from your cholesterol under the skin, it's the liver. So we need to ensure that the liver is doing very well. Is the liver having those enzymes that are supposed to activate the vitamin D? If it's the problem, then we need to sort that out. Is it the kidney? We also had the kidney being part of the organs in the body that ensure that this vitamin D is active. So we have to also ensure that it's okay. So you'll find us doing things like serum electrolytes, where we shall look at your calcium levels, look at your phosphate levels, the magnesium levels, potassium and all that. Then we shall do the liver function test to see how the liver is working. Then we shall do the kidney function test to dig deeper on how our kidney is working. Then the other things are usually the x-rays. When we do the x-rays, we are able to get some of those deformities, which will still strengthen our conclusion of the diagnosis. But majorly, the major two that we usually do is the calcium and then the vitamin D.
Now it's like an assumption.
Yes, please.
The child has come, you have confirmed clinically it's rickets, you have done the tests, they have all proved that this child has rickets. How do you always manage such kids or babies?
Well, we supplement them, put them on supplements so that we boost the amount of vitamin D, because remember, it is the root cause of all these things. So we put them usually on vitamin D supplements. Then we also usually encourage our patients, expose the baby to sunlight, those that have been indoors. Then the other thing is now to try to rectify these complications that have come in. Just like the bowing of the legs, we ensure we put them on casts to ensure that the bones are strengthened, are well aligned. And then those that are having other complications that are coming in, we also try to manage that. But the major issue is vitamin D supplementation.
You've said such parents should expose their kids to the sun. However, I would love to know from you, which periods should they expose their kids to the sun? Someone may come in the afternoon in the hot sun and expose their kid. Are there recommended periods?
When it's too hot, it's also discomforting. So we tend to tell our patients to go very early in the morning when the sun is coming out, it's not so hot, and then very late in the evening when the sun is setting. You can still get that vitamin D. Actually, for those who are breastfeeding, that's a very ample time, because you can sit with your baby under the sun, you breastfeed, and the baby is also getting the sunlight.
Okay.
Yes, please.
Also, in regards to that, which package could you give the viewers in a way they could prevent, maybe safeguard their kids from getting rickets?
For those in self-contained houses, please let the children play from out. Even you, the adults, please, once in a while you need to get exposed to this sun. It's for your own benefit. Then we have the World Health Organization has tried to put an end to most of these diseases. That is through fortifying most of the foods. So you'll find that you have this food that you are going to get. For example, if you look at the wheats we usually get, they are fortified. So you find that the wheat has come well packaged, and on top of the nutrients it's having, it's also fortified with vitamin D. So this is to ensure that you don't lack. Usually also the fruits, we have what we call the bananas. These are very good fruits sent from heaven to us. They are very rich in terms of vitamin D. Please let your children enjoy them. So fruits, very many fruits. I've only picked out the bananas because they have a higher concentration compared to others. But if you can have most of the fruits, well and good. Then the fortified foods, good, we have it. But majorly, those who are breastfeeding, ensure you expose the baby to sun.
Let me say someone, a viewer who is unserious, you have given us all these measures on how they can prevent rickets. Are there complications which may arise in case someone has gotten the rickets, they remain lactant at home, they have not gone to the health center or maybe a hospital to seek medical attention? Are there some complications these kids could get?
Just like we talked about all those complications that are coming into the bones, because the major issue now is coming to our bones. When you look at the knees bowing, that is going to disfigure the child. Okay, it's going to make also the stability of the child while walking difficult. The chest, we are going to cause deformities of which we might not be able to rectify. Our chest is supposed to be in the normal shape, but now that carving, it comes along with very many complications, both to our lungs, both to our bones. Okay, and in terms of teeth, remember the child needs to eat, but now the teeth are not developing. So in the long run, you are going to find that it's going to be one disease, but you'll end up with things like malnutrition. So the better or the earlier we prevent it, the better.
Thank you very much, Dr. Tony, and also to the viewers who are with us. In this first segment, Dr. Tony took us through rickets, and he has told us that this is a disease which affects can affect the adults, but also it mainly affects the children as a result of vitamin D deficiency, and kids can end up having bowing of the legs, which is like carving of the legs, and it said not only the legs but it can affect the whole skeleton or maybe the bone system and the body. Let's first get for a short commercial break, then we'll be back in the next segment where Dr. Tony will take us through the next disease which affects your bones. However, this will be for the adults. Let's get back. Thank you.
West Nile TV, lighting up the region.
Ekiki?
Owangula.
Nsasula emyezi 3 n'empangula.
Hey!
Ha!
Abaye, kubadde ki?
Kituufu wensasula emyezi 3 mpangula. Kituufu.
Subscribe for 3 months to any package of your choice or grab an Azam TV kit and pay for 3 months and stand a chance to win life-changing rewards. Android smart TVs, fridges, motorcycles, and that is not all. You could walk away with free subscription or the grand prize of 20 million Ugandan shillings in cash. Yes, 20 million grand prize. Subscribe today and enter the draw. For more information, 031 2308 900 or visit any Azam TV dealer near you.
Azam TV, entertainment for everybody.
Look out for StarTimes Solar to unwrap your lighting and entertainment experience this Christmas. At only 700 shillings daily charge, get yourself a StarTimes S50 that comes with lighting, phone charging, strong lithium battery, radio with a flashport and a Bluetooth speaker. For more entertainment needs, get yourself a StarTimes S130 that comes with an extra 32-inch TV screen and 2 years free StarTimes subscription. StarTimes Solar, more than just solar.
West Nile TV, lighting up the region.
We'll be back, dear viewers, from that short commercial breather. It's still the DAKTARI program, and this is a healthy episode which airs on West Nile TV every Thursday from the hour of 11 a.m. to noon. And today we are delighted to be joined by Dr. Tony Lwanga from IMCC Care Arua branch, who in the first segment took us through a disease which affects the bones, and here we looked at rickets. Though many people attribute it to only the young, he told us even the adults can be predisposed to rickets. Then in this segment, he's going to take us through another disease which affects the bones. However, this is now mainly to the adults, and it's called osteoporosis. We'll be back from that short commercial breather. Dr. Tony, you can speak on from there. What's osteoporosis?
So I tried to look for a simpler way of defining it so that someone out there can understand it. But it's a skeletal disorder. Skeletal meaning we are talking about the bones. That is characterized by decreased bone mass. Bone mass, I'm now talking about how strong the bone is. So we have these kinds of people who are having a disorder or a disease of the bones, and that disease is characterized by reduction in the strength of the bones that they are having. And we shall see on some of the repercussions as a result that comes in as a result of decrease in the bone mass. So it's majorly that disease for the elderly, for the bones, characterized by reduction in the bone mass.
We would love to know from you. Yes, you have attributed it to the adults. Is there a possibility that a young adult, maybe a baby or child, could get osteoporosis?
Osteoporosis. Yes, depending on the risk factors, because as we shall see, the risk factors are diverse. It's not only the elderly. If you are young, but you are having most of these risk factors, definitely it can contribute and you have osteoporosis even when you're young.
Then also for the case of rickets in the first segment, many people knew it only affects their legs. Could osteoporosis maybe also have specific bones it affects, or it's a general system?
Called the most common bones that are affected, but not that word, most common. That means they have very many other bones that are affected in this disease, but the most common ones that we see are the ones for the spine, that is the vertebrae, the ones that are at the hip, and then we come to see in the arms. You will notice the similarity in all those weight-bearing bones, the bones that are going to do the support. So we tend to see it that they are breaking simply because the bone mass has reduced. So those that do the wearing are the ones that are most at a risk.
I hope the viewers you have gotten, in case you are an adult, you could be at risk of osteoporosis. However, also when you talk about adult, is there a specific age? Yeah, I would love to know that.
Age, we see the very elderly. Those are usually above 60 and above. That's where we usually see the common. But of recent, we are seeing that diseases are not reading books. Just like you see in terms of the pressures and diabetes, we used to see it mostly in the very elderly, but now we are seeing as early as 30s having it. So I cannot definitely say that those who are 60 and above, you have a must know. Even someone at 50, as long as the lifestyle, the predisposing factors are still intact, definitely they are also able to get the disease. But we usually see it in those that are really the elderly.
So which things could the viewers be doing in these youthful ages which could put them at a risk to develop osteoporosis in their late 60s?
That means we are now at the point which we can talk as the risk factors that can predispose you to this disease later in your life, even in the childhood. So we can classify them excuse me, we can classify them into two. What we call the modifiable, or those that you can change, and then the non-modifiable, that you don't have any control over it. Things like age, that's the number one. As you grow, the chances of your bones losing this bone mass becomes higher, so that will put you at a risk. Then we have the women and the men now that we are talking about sex, you'll find out that we find it more in women compared to men.
Is there a reason?
The reason, I could say most of the other things that we are going to talk about, things like exercise, you find men exercising more, so you find their bones having more bone mass compared to women. Then we have an issue of menopause. Now, when you are a woman, when you are still ovulating and seeing your periods, you have this good hormone that makes you glow, the estrogen. It has a very good function in terms of pushing the calcium into the bones. But when we switch to menopause, you'll find that there is that defect now. And you find their bones tend to become weak simply because the calcium is no longer going in. And that puts them at risk. But we also have, I would call it menopause for men, that what we call the andropause. It's simply because our testosterone levels have gone down. So they also play part in pushing the calcium into the bones. But the difference is the significance or the reduction in terms of estrogen and the rate at which we find the decrease of calcium in the bones in women is so significant compared to that of men. So we find that the effect of their off being estrogen is so pronounced compared to men being off or having a reduction in the. So the impact, we see it more in the women because of their getting off or their decrease in the estrogen compared to the men when we have that decrease in testosterone. Then the other factor, it's so funny that if in your family you have had an elderly who has gotten these fractures or this disease of osteoporosis, then you have a risk of getting it too. Research shows it that there are some genes that have been linked with the risk of having osteoporosis in adulthood. Then we have those that you can modify. There we are looking at things like alcoholism. If you are taking a lot of alcohol, there is a way it impacts on the rate of your calcium getting into the bones. Then smoking also affects mainly calcium. The alcohol and the smoking, it's in terms of absorption of calcium, so it will put you at a risk. Then we have, like we said, in rickets, we have people who are having diseases such as epilepsy. You find their own certain drugs. So now here we are talking about drugs. We have some of the drugs that can put you at a risk. And they are usually, I see very many people telling me, may I have my ulcers? So 1 to 3 times they go, excuse me, they go to the drug shop and they pick these drugs we call the proton pump inhibitors. If you are on such drugs for a very long period of time, it can put you at a risk simply because they disturb the way we absorb this calcium. Then for the ones with epilepsy, the drugs that we give them to treat or to prevent them from getting those seizures, they do what we call inducing some of the enzymes that break down the other enzyme we talked about that enables you to push the calcium into the bones. So you'll find that that enzyme is defected or it's not active, so there is no movement of calcium from the blood into the bones. So you find their bones become weak with time. Basically, those are some of the risk factors.
Then in regards to this, in the first segment you told us rickets is as a result of vitamin D deficiency, or maybe the body lacking vitamin D. Is there also a nutrient component which could maybe lead to osteoporosis?
Yes, with the osteoporosis, we said the bones are becoming weak. Okay, so what makes these bones strong enough? It's the calcium. So anything that is going to play around with the way we metabolize or we intake the calcium, in the long run, it's going to put you at a risk. If you find people who are basically vegetarians, yes, for them they can get from some of the fruits, but you might find that we have most of the calcium in things like the eggs, the meat, I see people having oxtail that is very rich in calcium. So if your diet is not rich in calcium, you'll find that it puts you at a risk. So the nutrient there we have to look at is calcium. We have to have enough in terms of absorption and in terms of the way it gets to our bones.
Okay.
Then we shall be able to be off this disease.
All right.
Yes, please.
Bones being weak. I would love to know from you, could lifting of weights puts a viewer at risk of getting this disease?
Yes, that is, it would be what I can call a myth in the population. You'll find that actually doing exercises, some of the things that strengthen your bones is doing exercises. In the risk factors, some of the people who are sedentary have weak bones simply because they are not doing a lot of exercises. So if you are doing weightlifting, I get that as a form of exercise. So in the long run, that should strengthen your bones, so it will not put you at a risk of getting the fractures unless the weight falls on you and it breaks the bone.
Like I told you, indeed, it's an exciting and educative session. Then also would love to know from you. We already have the viewer who is 60 plus viewing us. How could they know that they are having osteoporosis?
And the symptoms of osteoporosis. Now, it's so funny that you don't have such a peculiar thing that you will tag that now this is the sign of osteoporosis. Most of the time, all the symptoms that you are going to find, it's as a result of a complication that has come in because of the osteoporosis. So such people usually come with the most common thing is the fracture of the bones. Now, these people can get a fall or a slip and they just fall and then the bones are broken. Some of them even actually have what we call pathological fractures. They have, all of a sudden they start getting pain simply because the bone has crushed. And we usually see that in the bones of the vertebrae or the spine. You find that these bones are just like how you see these fingers of mine, they're on top of each other. But remember, these are the bones that are bearing all the weight. So any stress that may come up, this bone in the middle might break and it will compress.
Yeah.
Now, when it compresses, it's squeezing the nerves that are coming in between these vertebrae, so we shall now start getting the pain.
Back pain, yeah.
So you find that most of the time they will be complaining of back pain, back pain, back pain, back pain, simply because some of those bones in the vertebrae have gotten broken. When it comes to the hip, remember the legs are the ones supporting the whole trunk and the upper body. So they get pains in the hips. They can get disability simply because out of the blue they are unable to move simply because the fracture has come in on the leg. So usually it's as a result of the complication that has come in. Wherever it comes in, then they get that symptom. But the common one are the pains where the fractures have happened.
The viewers hope you have gotten indicators which you could know that you have osteoporosis or the disease which affects the bones in your aging or adult ages. However, we would love to know from you. You talked of these fractures because you told us there is no clear symptom that someone could present with when they have osteoporosis. But they have gotten some of these, you have told us, they have gotten the back pain, they have gotten these pathological fractures, the bones are all the time breaking after simple falls, and they have come to you in the hospital. How do you always confirm that this is osteoporosis?
Okay, blood workup and then the imaging, which we can call the X-ray. With the imaging, once we take the X-rays, we're able to look at the bones. One, it will tell us where the fracture is, and we shall get to know this is where the pain is coming from. Then the intensity or the way the bone looks. A bone that is well nourished in terms of having enough calcium looks different from that is not having enough calcium. So one is pale, one is more, you can easily make the outlines. So in such cases, on those imaging, we are able to tell that this bone is not appearing like the normal way it should appear. So that tells us that there is a risk there. Then in terms of the blood workup, remember, we are having less of the calcium. So there are some hormonal tests that we do that can tell us that, okay, there is a problem there. and that there we come into what we call the parathyroid glands. They're the ones that are supposed to be driving the calcium into the bones. But once we see that they are on the high, it tells us, okay, we are having this deficiency of calcium. That's why these parathyroid hormones are getting high to ensure that they are driving all the excess wherever possible we can get the calcium. And actually, that's one of the things that disturbs, because once the parathyroid hormone goes up, it's going to cause the small calcium that is inside the bone to come into the blood circulation, because we need the calcium for other things. Your heart pumping, we need calcium. Your muscles contracting, we need the calcium. So if our intake is not good enough, the parathyroid will go up because we lack the calcium. The most common point of getting the calcium is through the bones. But getting that calcium out, it's making the bone weaker. Okay, so you'll find the test, if you do that parathyroid hormone test, you'll find that the level high. Then the calcium itself, when we do the serum calcium levels, we shall find the calcium levels down. Then we can also look for other things like the phosphates. The kidneys also having issues, because the kidneys are supposed to ensure a balance of calcium. But if we are excreting most of them, that means our kidney is having an issue. We need to correct that so that it keeps the calcium in. So we can also do what we call the kidney function tests. Yes, those are some of the tests that we can do.
So we assume also in this case, someone has come to the hospital, you have done your tests, you have done the x-ray, and you have seen that this is not a normal bone, and maybe you have also done the kidney function tests. We would love to know, how do you always manage such patients such that maybe their bones can gain full strength?
Them on calcium supplements, first of all, to ensure that we sorted the issue of that deficiency in calcium levels. But also our diet, we need to ensure that these people are put on foods that are rich in calcium. So you find us telling them to take things like milk, having eggs on their menu, having fish on their menu, so that it improves their calcium levels. But we put them on actual supplements for calcium. Then, like we said, some of the risk factors is sedentary lifestyle. We tend to tell these people to do exercises. Now, you will not tell an old person to start with a lot of vigorous exercise. It's going to be something slow, be it walking, be not just sitting around and waiting for the grandchildren to do. That's why actually we usually like taking the grandchildren to our judges, because they make them active. Don't do this, don't do this. As they're moving around, it's a form of exercise to them. So put them on calcium supplements, ensure that their diet is rich in calcium, and then ensure that we do exercises and also put off some of the behavior changes actually that were predisposing us. Remember the alcohol bit and the smoking bit, we have to put it off. So those are some of the measures, but in the hospital, the major one we do is calcium.
In regards to that aspect, we assume also there is a patient, let me say client, is elder, is 60 plus. They have gotten these signs and symptoms that they could be having osteoporosis. They have decided to remain home. Are there complications which could develop as the result of poor management of such cases?
The commonest complication you are going to get is a fracture. Because remember, your bones are weak. Any sliding in the bathroom and you fall, the bones are broken. Okay? The other one is disability. Definitely, if your spine gets broken, it will injure the ones and the spinal cord. You cannot move, you cannot do what. Then, when you look at those bones, if you ever had oxtail, there are those marrows that you see in there. So some of those, as a result of the bone getting broken, you can have what we call emboli. So whenever it goes, if it moves or a fat deposit moves from your bone, it goes to your chest, it will cause what we call embolization there. So you will end up with what we call pulmonary embolism, and that can actually kill you. Should it go to the brain and it blocks any blood vessel that is leading to some part of the brain, you are going to get a stroke. being immobilized because your bones are broken is going to put you at a risk of infection, the likes of urinary tract infection, chest infection, simply because you are now in one place. So it's really a very bad disease in terms of getting to the complications. But all of them, if you look at them, they rotate around getting a fracture first. Then now the fracture can put you at risk of infections, pulmonary embolism, the strokes, and all that may come in.
In regards to this, you have already taken us through some of the preventive measures. However, you can highlight in more on how the adults and also those aging or tending to the 60 years prevent themselves from getting this osteoporosis.
In our youthful age. In that by the time you reach at that age, point in life where the age is coming in, your sex is coming in, you don't want other things to be on top of that. So we shall start in our youthful age. Please, the young adults of today, stop things like smoking and taking alcohol. Because remember we said some of the things that are bringing that are putting us at risk is alcoholism and then the smoking bit. So if you can put it down, I believe you have fewer risk factors in your elderly life. Things like not exercising. These days we want to be football, you want to get your phone and you play it on the pads. No. Go to Twambe, go to the field and play football. Okay? Go to the gym and do aerobics, do the jogging. We have very many mountains here. Do the jogging there. It will strengthen your bones that by the time you reach in your elderly life, your bones are really strong. Then for those that don't want to come and seek medical help, please, drugs over the counter, in the long run, you are just doing more harm than good. Because a doctor will tell you, this drug, you're going to take it for this amount of time. But for you, simply because whenever you think you have some burning pain, it is ulcers, and you keep taking that, in the long run, as you age, it's going to affect you. So by the time things like your age coming in, we don't want that to be on top of you. So please, ensure you feed well, take things that are rich in calcium. I've talked about the eggs, talked about the meat once in a while, not having it regularly, and have enough fruits.
Okay.
I could say.
Indeed, it has been a very educative session in regards to these diseases which affect the bones, rickets and osteoporosis. However, we would love you to give in your key message as we conclude to the viewers in regards to rickets and osteoporosis.
Conclude to the elderly, as you take care of that child, please. Some of the children don't know. It's as a result of our behavior that we actually put them at risk. So please take care of the good children. In a nutshell, ensure your child gets vitamin D. Free from the sunlight, please ensure they get exposed. Then in terms of feeding, we have a lot of foods fortified with vitamin D. Ensure they feed on that. In a nutshell, I can say have a balanced diet for children, and then they will be able to get that. For the elderly, it is our behavior change that we need to act on. Exercise, alcohol, smoking are not good for our lives. And remember, a healthy body is one that is able to work. So if we keep ourselves healthy, then we shall be able to live longer, I would even say.
Yeah, it has been a pleasure having you on the DAKTARI program and also educate the viewers of West Nile TV. I know they have not remained the same, they have picked for the benefit of their health. And a healthy body is also a wealth pocket.
Yes.
All right. I've been your host, Sunday Junior Tom, together with Sophie behind the camera and in the production team. See you next week on Thursday from 11 to noon. Nice time.